different sections and sew it on with a surgeon right onto the heart. You can see that if you have a blockage, say if you have a blockage here, say if there's a blockage right about here, we can take a bypass as right as a vein and bypass it right down beyond the blockage. So it's like running new piping, new plumbing. So, and you don't have to touch this if you don't want, but it's an actual vein that came out of somebody's leg a number of years ago. So that's what your vein looks like. I have ties on it. So it's a lot of fun doing this, and hopefully maybe one of us or some of us will be future surgeons and doctors and maybe even heart surgeons. It's a great profession. What I'm going to do...
Jack, you got to get here on time. This is getting ridiculous.
This is actually Maine Medical Center here. So this is during the fall. And you can see this is the back cove. Here's Maine Medical Center. And I live right down in the operating room most of the time. So I'm kind of down in the dungeon area. And but it's a very, very big place. Has anyone been to Maine Med? So anyone has. This is me in the operating room. So I have an arm, and I'm taking a certain scope, and I'm taking that scope and I'm putting it inside this arm to take an artery off the arm. It's called a radial artery. This is all my equipment. I have to wear loupes, so that way I can see fine details. So when I look through my loupes, it magnifies. It's like binoculars, but it brings everything up close so I can operate. This is an anesthesiologist. He keeps the person alive while we operate. So the person's underneath this drape, just like this. This is an actual operating room drape. This is what we cover you with in the operating room. If you have any type of surgery, usually we put a big drape to keep everything nice and clean and sterile. So this person is under here, their arm is out, their chest is over here, we're getting ready to start heart surgery. Take a vein and an artery out of the arm and a vein out of the leg so we can do those bypasses. And at the end, I'll take some questions. So if you have questions, just wait right to the end. So heart facts. The human heart weighs less than a pound. So think about your fist. Take your fist. It's about the size of your heart. It might be a little bit bigger than your fist, but that's about the average size of your heart. And as you get older, your fist gets bigger. And about 1 to 1.5 fists. A child's heart is about the size of a clenched fist. Adult's heart is about the size. So between 1.5 and 2, sometimes there are people that have 3 fists of heart. So enlarged heart, which is another problem. So, and all goes back to how you eat and exercise, and you can get certain conditions that make that hard. Instead of like this, you can actually be this big, and we've seen that in the operating room. So that kind of leads to other problems. The human heart can create enough pressure that can squirt blood a distance of 30 feet. So, pass that around. This is what we replaced your leaky valve. That's what it looks like. It's an actual one.
I'll videotape his and I'll email to my computer.
Back on the table. No, those are valves. So that's what it looks like. If we were to sew in a new valve into your heart, if you have a leaky valve, or maybe your valve is what we call stenotic. If you have aortic stenosis, which is all this. Remember that long squiggly thing that was pulled out of the artery, one of the arteries? Your valve can get all this hard stuff that are attached to it, so it doesn't work well. So that's what we do using the heart-lung machine. And some of this equipment, this is a heart. You can see this is the pointy part of the heart. So this part, the apex, is right up here. And now we're using special scissors and a little blower, and we're opening up an artery. So those scissors that we use is right here. So I'm able to take an artery, and you can see this little curved scissor, like this. I have a couple of them.
Do you want sugar or something?
And this one. So we're able to, with these fine scissors, we're able to open up the artery. So if I were to take and hold the artery carefully, I'm inserting it, opening it up, and now I can take the vein I took out of your leg,
No, I think it's just because I'm trying to turn it
attach
off, but I was
that,
already doing something else.
I know the blockage is up here, and I take the other end of this and I attach it to the aorta, so I create like a bridge. So now I got blood flow going right down over the blockage, and now the heart has new oxygen supply. Okay, for the bypasses. There's things called the heart net. This is a heart net, so I'm able to use this to wrap around the heart, to move the heart around if I wanted to. I can move it in any fashion. I can tie it to the drapes, and that's called a heart net. This, believe it or not, this is a Thoratec LVAD. This is something that we use if this heart can't be repaired or fixed, and it's very weak. Some hearts are so weak that you need an external, like a fake heart. So this is attached to this heart to make this heart better, and hopefully in time this will make this better. If not, then you need something called a heart transplant. And so this is called an LVAD, and this is something that we use, yes.
Put any more video on it.
Yeah, like fake, yeah, there's certain hearts out there that are completely fake, and they provide, instead of having a real heart, we've got pretty much something implanted inside your chest that is, there's still a lot of studies going on for these, but this is called a left ventricular assist device. This kind of assists the heart. So these are huge. We did these at Maine Medical Center as well. And that is it on that. Pretty much went over all the equipment here. So we've got a lot of things. Everything here that you see we use in heart surgery. Scalpel blades, needle holders to hold needles as we pass through the tissue, little tweezers to do fine work. We have certain instruments that we can use that will go inside certain arteries, so that way we can stop the bleeding. And we have devices that we use. So you can see that valve I mentioned? We have to measure that valve, because you can't just put in any old valve. You have to actually have a size. So this is called a valve sizer. So we can measure how big that hole is and say, please give me a 26 millimeter pericardial valve. These little rings, these little valves have different sizes. Some are smaller, some are bigger, because everyone's heart's different. So that measures it. We can punch holes in the heart using this. So when I take the vein out of your leg, we take a little scalpel blade, go in the aorta, and we pop this in, take a punch, and it creates a little tiny hole, just that small. Now we can sew this vein on the end of that small hole. So this is called an aortic punch. And these are other cannulas that we use to go inside the heart to drain blood as well. This is called an ambu bag. So all of our patients after heart surgery, once we're done closing up your chest, we did all the work, and you're being wheeled up to our intensive care unit, where I'm going to be in the morning, tomorrow morning. We're ventilating you, so you need oxygen, right? So if you're not breathing on your own, you need to be on a ventilator for a day or so. So right here, as we're transporting you, we're breathing for you, like that. This is connected to oxygen, so as we're bringing you back up to the operating room, from the operating room to the ICU, we're ventilating, and I'll show you something really cool in the heart. So what we're going to do is I have that lamb heart. Any questions about the equipment, heart surgery, anything like that? Everyone ready for seeing a lamb heart? We're going to do a dissection.
And my point is, don't get to that point.
Yes.
You do not want to see this man again unless it's hand for something like that. You do not want to
Right,
see somebody
Hanford is
opening up your chest cavity ever in your life. Okay?
But if you do, we do a great job.
Yeah, they are great when they do. When we finally get there. That's good. Yeah.
Everyone's seen a blood pressure. Everyone had this done before?
Yep.
Yes? That's nothing new. You've had this done. All right, that's checking your blood pressure. So high blood pressure, not good.
Remember the guy yesterday, Super Sergeant? What was he?
I want to say it was like 180 over something.
No, the other one was the lower one was over 100. That's what caught my eye. It was like 150 over 110. I'm like, whoa, buddy.
Yeah, supersized. That big Mac that you saw up on the screen, not good. Remember that blockage after that? So always remember. And that takes, and again, it's years to build up. So this is from a little lamb that came from place. I've got little contacts. And the lamb now he's okay, but somebody will, he's good food for someone. But this, this is everything, this is the cardio respiratory system of a lamb. So we have, of course, in the middle, we take this out. We all know what that is, right? Heart. So that's a little baby lamb heart. Remember I said your heart is about a fist to fist and a half. When you're a full adult, it's at least a good 1 to 2. At least quite closer to 2 in an adult. So just a little lamb heart. This thing was beating away. This is what your lungs look like. This is exactly what your lungs look like. When I operated the day before yesterday, you see some nice, beautiful pink lungs that are very squishy. They got a very funny, it's very cold, first of all, but usually they're warm. So when you feel them in the operating room, they're very, very squishy. But this is what gives you oxygen, right? As we all learned. So if you look at think about this scientifically, not gross. If you think about it, because you're in science class, this is the cardiac and the respiratory systems together. Now, because of a lamb has a kind of a long neck, right? They have to, this is kind of like where their throat was, okay? The head was up here. So this is called the trachea. So what I already did is I intubated the trachea. So this tube coming out, when you come out of heart surgery, you have a tube in your trachea, which is your windpipe. You've all heard of a windpipe, that's where you breathe. So that's the windpipe of the lamb. I put a tube in it, because I'll show you what we're going to do next. There is another little area here. See that kind of like, if I were to hold this, if I were to grab this around, I'm going to dirty one of these instruments. This one. If I were to take this, okay. Right now, you see this tube? That's your esophagus. So do you know what the esophagus is? What? Right, it's where your food goes. So this is where the lamb's grass, grains, went right down this food tube. So it's connected up here, it goes right down, and it always is behind your trachea. The trachea itself has rings. You can actually see these rings very carefully. You can actually see that there's kind of like white strips. You can actually see like these white looking, it's full of strips. That's the trachea, that's cartilage. So the heart itself, remember those little floppy things I told you about? That's the appendages. So this is the right atrial appendage, and this is the left. See how they're kind of like, they just kind of sit there and they're kind of floppy? It does fill up with a little blood. It doesn't contribute much to the function on how the blood gets squirted out, but it does fill up with a little blood, both of those. This is the front of the heart, so this is in the, the chest of the lamb. So you can see the arteries on the surface here. I'll grab this. So, arteries, so again, thinking scientifically, you have major arteries. These lines that you see, these are arteries. This is the anterior descending. We actually name these arteries. So when we remember that catheterization film when you squirted the dye I showed you, we know where the blockages are based on, that's how it tells us where to do the bypasses. Where he ate too much of that big triple burger cheeseburger and had that blockage, we know exactly where it is based on that. So we use that as a map to say, all right, surgeons, take a vein and put it to that artery. So you can see there's an artery there, there's one on the back of the heart. So we know exactly where we need to go to do the bypasses. If you also look, this is the pointy, so every heart has a little pointy area. That's the apex. And then this is the base. So, and it, when your heart beats, it beats together. The ventricles kind of work in different ways. So you hear a love dub. You know, if you listen to with a stethoscope, you hear a love dub. It's closure. That noise that you hear. You've ever heard? Anyone heard their own heartbeat or somebody's heartbeat? You hear like a dub 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 dub. That's closure of the valves inside the heart. So all those valves I talked about, those old doors, some are opening and some are closing. When you hear a murmur, that's the leaky valve. If a valve leaks, it creates this other. It goes lub dub, or lub dub. So depending on where the lub dub falls, and the tells you what leaky valve could be leaking. Just by listening to it, you can kind of get an idea of which valve is not working the way it's supposed to, and it's opened up a little bit. So it's amazing.
And what can cause valves to not work correctly? Besides cardiovascular disease.
Yeah, sometimes when we dissect this, I'll show you what holds the valve together. Chordae tendineae. You can have ruptured cords that come off. The papillary muscles. There's things inside the heart called papillary muscles that they have ruptured cords and makes the valve just flop.
And how would you rupture that? Something like
Well,
that?
if you have ischemic, so if you have a heart attack,
Yeah.
and you have a heart attack to that papillary muscle that
Oh,
holds
okay.
those little cords,
Right.
it just ruptures.
Okay.
It doesn't, because there's no blood supply. Because everything inside the heart needs blood supply.
Right.
So
Thanks.
if you don't have blood supply, so the heart itself provides blood supply to your body, right? And your brain, every cell in your body. Well, the heart itself also supplies blood to itself too, through other ways. So I'll show you there's little areas. So if you were to take this, I'm going to put on, stay clean here. If you were to take this part, and I'm going to ventilate
This one. And then what we'll do is we'll put
You know
them
what
here
ventilate means?
to my
Anyone
computer.
know what ventilate means?
This is
What's ventilate?
sex.
But we can get it from his
Take a
to
breath.
mine with a key, right? And
You're
then maybe we can
ventilating
put it
your
on a
lungs.
keynote for
Sometimes you
Mrs.
take a breath,
Fitzpatrick.
sitting there watching. I'm going to attach this ambu bag to this tube. Now watch this. You see those beautiful lungs?
This is the back of Madison's head right here. Oh, there she is right there. There she is.
Can you see that? I'm ventilating this little lamb's lungs.
Oh!
Pop that off.
Bah! Would not be good.
So you can see how there's little air sacs inside there, inside the lungs, called alveoli.
What do you got?
Think of them as, you grab that Hannaford here and drag, big bunch
Oh,
of
yeah.
grapes, a big bunch of grapes. That's it. Think of each grape as an alveoli. You have millions and millions and millions of air sacs called alveoli. And that's what exchanges carbon dioxide with oxygen. So you have yes, you have that.
That's a little project you made the other
That's
day when
a
you,
great project.
yeah, diaphragm and stuff.
Yes.
I had a real nice one, but some kid sat on it, so it kind of.
That's perfect. So you can see, for real, so as we're taking a breath, this is exactly what your lungs are doing with each breath. Okay? So,
So the alveolus are what I talk about as being grapes. The grapevine is the bronchies. Down to those grapes are wrapped around by a net, which is capillaries. Capillaries are 1 cell thick. That's why we're getting the transfer of oxygen and carbon dioxide, getting something that the cells need and getting rid of the waste that the body doesn't need.
I'm going to open up a lung so you can see what it looks like inside of a lung. You'll see, this is the inside of a lung. You see like a bunch of holes?
Hey, Squeaky.
It's very spongy. It feels very, I can feel the air in it. So just like your lungs, it fills with air because it has to exchange carbon dioxide with oxygen. So you see those tubes?
Squeaky.
Those are the bronchioles. So remember the trachea? take a breath, it goes down into your lung. Well, through this big tube where the air goes, it goes into your lung and it breaks into all these little tiny little tubes. So each tiny tube is carrying air to the tissue around it. And the capillaries are attached to bigger arteries and veins that go from the heart. So that's how it exchanges the air. And it goes right from the little capillaries, okay, from the little tubes to the capillaries into your bloodstream, into your heart and back out to your brain, and to your whole body. So opening up the heart, we have what?
10,
12 minutes.
12.
12 minutes? So we're doing pretty good.
Yeah.
So what I'm going to do is I'm going to open up this heart right in half. Okay, so I'm cutting down through the whole heart. So I'm going from the base to the apex, like I told you. Okay, and when we open up the heart, you're going to have chambers. So, okay, so you see where you have these chambers inside your heart? Isn't that pretty cool? Nobody's grossed out? Nobody grossed out. I don't see anyone passed out. Nobody's passed out. Nobody, everyone's breakfast is down still. Right? I don't see anyone on the
Except for
floor.
the guy that supersized me.
The floor's clean as Kurt. Look at that. So inside here is these chambers. Now you see these little spidery web things? This is what I wanted to show you. Where you can't really appreciate this in textbooks as well, but you see it for real. You see these like little spidery things? A little spidery looking web. See that? Everyone sees that? There's one there, there's there. This is called chordae tendineae. Chordae tendineae. See how it's attached to, like, one of them is attached to like this big thick muscle. And another one, this little spidery thing is attached to this big thick muscle. This muscle and this muscle inside the heart. Those are called papillary muscles. It's attached, papillary muscles. So when these contract, when the heart contracts, it pulls these little spidery things. Okay? So picture when those muscles contract, like this, it pulls little spidery things called chordae tendineae, which pulls this big little leafy thing. That's, right here, is one of your valves. So that's your valve. Okay, so, and this one here is your mitral valve. So this is the left ventricle of the heart. So this whole heart chamber fills with oxygenated, oxygen-rich blood. I'm going to take that and I'm going to cut out that valve and show you. So I'm going to take it and I'm going to take out the whole valve. And with the spidery thing attached. This is exactly what we do in heart surgery. So we'll take out the whole unit, including the spidery part. So that's a whole valve. Okay, so your valves are made up of leaflets. So I took out one of the leaflets. So leaflets working together is what closes the door from one chamber to another. So that's a leaflet. So some valves you have 2 leaflets. Other valves you have 3 leaflets. So as the blood comes through, the leaflets close to closing the door, the opening, and they open up again when pressure changes and when the contraction of the next ventricle squeezes. So those are the leaflets. If I were to continue and cut up through this heart, what I'm going to do, you got to orient. You have to figure out where the front part is again. So this is the front. The reason why I know it's the front because see those little floppy things? Remember they're called the appendages? They should come towards you. That means you have the anterior part of the heart, meaning the top. When the floppy things are away from you, you have the posterior, which means the back or the bottom, the back side. So I'm going to go up through another little area called the aorta. So what I'm going to do is I'm opening up this lamb's aorta. So right now, I'll show you this. This is pretty cool. Okay, I just made an opening. Right here, you see that big hole here? Right there where I have my finger, right there, that hole. That big hole right in there. That's the aorta. So you see this big red tube here? red is oxygenated blood. Blue is deoxygenated blood. So this tube carries blood from the ventricle through that tube to this lamb's brain and to its body. So I'm able to go up through, and it will drop down the back part of this lamb. So this is the aorta that goes down its spine, down in its back, all the way down to carry blood, oxygenated blood to its belly, to its legs, and to its bottom half. Okay, so through that tube. The other area here is the pulmonary valve. So if you were to look carefully here, okay, so that's the aortic hole. This is the pulmonary artery. Okay, so this is the other big tube. That's this blue right here. Okay, so this is where deoxygenated blood goes. So now I'm going to put my finger in here, and this is leading to each lung. So each lung, that's where the blood is going to go towards to get oxygen on each lung. Now there's another chamber here that we're going to open up. You can actually see there's another valve here. That aortic valve has 3 little leaflets on it. You can see there's one little flocky thing. It's very thin. See how thin those are, those leaflets? So that's its door, that's its trap door. 1, 2, and here's the third one here. So if this was back together, the 3 leaflets come together and allows blood to go in one direction only. So that's the aortic valve.
If it's 3 leaflets, is it called tricuspid?
It's called tri-leaflet.
Try something or bi something?
So aortic valve has 3 leaflets. The tricuspid, tri means 3. Tricuspid has 3 leaflets.
Right.
So cusps. So tricusps.
Right.
So tricuspid is on the right side of the heart. The aortic
And you have the
valve.
bicuspid too, right? But isn't that a tooth?
Bicuspid means 2. That's right. Bicuspid, like the mitral valve,
Yeah.
is a bicuspid. It only has 2 leaflets.
Right.
The mitral valve.
Right.
Bicuspid.
Right.
So, and inside here, does anyone have questions about this? Any other questions that you see? So I'm holding it upside down by its lungs.
And that may seem a little bit gross, but I'm sure there's countries out there that would eat that. You know?
Oh yes.
And there's people out there that have to eat
You
that.
have to eat this.
Have to eat the whole thing because that's what food they got.
They don't waste anything.
Yeah.
It's lamb. I'm sure there's
Deer people would do that too.
if you're eating deer or cows, steaks. This is all part of what we're made out of. This is good review. This is I'm going to show you something else too. There is a hole. Here it is. I found it. Okay. Remember I told you that the heart needs to get its blood supply? So the heart provides blood to all your cells, right, in your whole body. The heart itself also needs to get blood. So in order for it to do that, it goes through.
Excuse me, Mr. Curran?
Yes, ma'am.
Morning. May we have Nick Belflor for dismissal?
On his way.
I do.
See,
Nick.
you got the good part.
So you see that hole here? Everyone can see that hole? There's like a hole right here. That's where the heart gets its own blood supply. So it's called a coronary sinus. There's one on the right side, and there's one on the left side too. Sometimes they're hard to see. Right here. So there's another one. So I have my instrument in the left coronary sinus. So there's only 2 big holes that this whole heart gets its blood supply. And that blood goes to all this tissue, all this myocardium, endocardium. It's very smooth inside. It's got to stay smooth because that way as the blood goes through your heart, it doesn't develop blood clots. So it has to be nice and smooth and glistening. All this like spidery looking, see how it's kind of spidery? This is exactly what it looks like in your heart. It's called trabeculae. And it's an area, it's all very smooth as I'm feeling it right now. but it's all this area is what the inside of the heart needs to be in order for it so it doesn't develop clots, because you can get clots in your heart. I've helped take out clots in people's hearts. You can develop clots because of certain problems and things. So we've had to open up the heart in certain areas and take out the clot. And just take it out. It's like a big little jelly mass. Okay, and then we close up your heart again. So it's all very smooth and glistening. You can see how thick this is compared to this side. Like this side's a little thinner on its edge, and this edge is thicker. This is the left ventricle. Remember I told you that left side? The left side is the big power horse. So it's like the more weights you lift, the bigger your muscles are going to get, right? If you lift weights, it's like Arnold Schwarzenegger and some really big weightlifters. So the more they lift muscles, the bigger their muscle gets. So same thing with the heart. The left ventricle has to is responsible for pushing all that blood out to your body. So when it has to push all that blood against that pressure, it builds up quicker, and it's much stronger. So, I have time for questions? We have what?
Yeah, I just don't want anyone else with. Yeah, I mean, we can let the whole hallway empty out to UA, and then we get 3 or 4 minutes,
3 or 4
definitely.
minutes? Good. Any questions about anything? Yes.
Where was the sac around the heart?
The sac. Good. Let's find the sac around the heart. Remember what the sac is called? Remember the name? It's called the pericardial sac. And it's a lining, like I said, when we open up your chest, it's put together like this. So, you see this little, you can almost see through it. See that? Almost see through it.
And what can damage that?
Nothing, you can get infection of it,
Yeah.
but usually it's just a thick lining. So that wraps around the heart. So see where it covers up the heart? You have to open up the pericardial sac to get at the heart. See, now I can get at your heart, and that's exactly what we do in heart surgery. We got to open up your sac, and then we get into your heart. So,
And you got to sew that up after?
sometimes we do. A lot of times you don't need to.
Yeah, does it
We'll
itself?
just scar over,
Yeah.
and it will get adherent to a lot of tissues. It'll get stuck to things around it.
Cool.
But that is pretty much what I wanted to cover today. Any other? Yes.
Which way is like more effective for checking your pulse, like this way or this way?
Checking your pulse. Either way is good. You can check. There's pulses on each side of your leg. There's pulses in your feet, arteries. So most typically, when you go to a nurse's station, the doctor, they'll do it in your wrist.